Show her this.
Okay.
I raise this up because if you put it right in front of their face, they could end up seeing a bloody mess. And this Mayo stand, you know, you're not sure if everybody's comfortable with even one drop of blood. So it's up like that. And I see this package is sterile. So as long as we keep everything on the package, there's less chance of infection. All right, now this is, as you can see, it's got a white ring around it, and it's about 1.5 centimeters, and you can see the blue ink that was put on before it was numbed. Now the key to this is, rather than going right down the middle, is to go around it. And we know we're going to have to do an ellipse, so let's just go ahead and do an ellipse from
And you let us know if any pain.
From the start. We are doing an ellipse, and this thing, and the ellipse needs to be at least twice as long as it is wide. And we know on the back, the skin and subcutaneous is a couple of centimeters thick. So we'll just go ahead and we're using 1% with epi so that there's less oozing. And actually, the cyst is inside there, so we have not cut the cyst. We've gone all the way around it, so that means there's less chance of it coming back. If you cut into it, you have less control of getting it all out. So it's inside there, all controlled. You want to see it?
Sure. That is awesome.
So it's in there.
Cool.
Questions?
No.
Oh, that's clear.
All right, 2O nylon. This is big enough I can take a healthy bite, and I'm going to go halfway through and then go the other halfway through. Two throws, go the opposite way, one throw, go alternating. That way it's a square knot rather than a granny knot. And then we leave them long because we don't want them to untie and fall apart. Now sometimes you can go all the way through with one push and come out the other side. And let's see, what else? What other tips can y'all think of that you've learned that helps this go a little better, faster, more efficient?
Pretty much you said everything.
Mm-hmm.
Well, one thing I like is giving the lidocaine and then waiting
Time.
at least 5 minutes.
To kick in.
Yeah, because a big mistake is to start in 3 minutes before. See, it takes 5 minutes for the epinephrine to take effect. And so it's a lot drier and cleaner. And then, so one of the best things you can do is just have a comfortable patient before, during, after. So that helps. And by going full, a good deep stitch like that, that will seal the subcutaneous as well, and there's less chance of having bleeding afterwards or a pocket of blood from where the cyst was underneath. Otherwise, a 2-layer closure is needed. And if this had been larger, I would have used a 2-layer closure. An underground layer of Vicryl or monocryl to dissolve, and then nylon for the top. And you got to grab it right there. If you grab it too high, it's round, but down below, the needle has been flattened. All right, we're almost done. Cut it off now if you want.